Dr. Mariam Martin.
Thank you so
For
much.
the participants, you can ask the questions in the chat box. Dr. Sahar is going to look after that thing for you. And whatever the other questions in the end, we are going to ask from our rest of the panelists. Please, ma'am, carry on. Thank you.
Thank you so much. Thank you so much, Walid, as well, for helping us put it together. I should also thank Apna Merit Program for putting in the effort to help us improve the healthcare delivery system in Pakistan. We are here today to make it easier for everybody to understand BLS and ACLS. This is not meant to be a replacement for BLS and ACLS training that is being conducted in majority of the hospital around the world, but it is going to act as a primer to get BLS and ACLS recognized as it should be known. As Dr. Ashraf just mentioned, I'm a staff cardiologist and a graduate of Down Medical College. I do hold appointment at different universities, but my main concern now is being the lead cardiologist for the Apna Merit Program. And I'm also the past president of the Association of Pakistani Descent Cardiologists of North America. We are trying to improve awareness of BLS and ACLS in Pakistan. APCNA, as I mentioned, is a nonprofit professional and educational organization that fosters scientific development and education to improve the quality of medicine and delivery of healthcare system without regard for race, color, creed, gender, or age. Webinars as listed on the flyer are meant to be an overview of the BLS and ACLS. The actual certification of completion will be by your own institution after you do your viva or your oral presentation, your skill testing. Apna Merit will provide only the certificate of attendance for this conference. This primer is meant to be a prelude to your institutional education certification for the BLS and ACLS. Basic life support, as we all know, is something that we need to be something that we need to give to somebody who is in need for help. It is given by the person who sees someone in distress. That could be you, it could be a lay person, and it is somebody that you're looking out for and is in distress and is not responsive. Yes, you do not need to be a doctor, you do not need to be a nurse, but you can be anybody on the street who can help. A person in need of help may be anyone. You may find someone not responding to stimulation, like touching, not breathing, choking, or God forbid, has no pulse. It could be one of your near and dear one, or it could be somebody else out on the street. In such a case, knowledge and skills of resuscitation or CPR are needed. You may need your skill to use an AED to help the person, especially in those people that don't have a pulse, and also help people that need to clear their airway of obstruction, whether the person is a young one or an old one. And as you know, the young kids are so vulnerable to putting their things in their mouth, and elders sometimes can swallow the dentures. It is surprising, how often we find somebody that may have swallowed the dentures and not know it, and that's why they were choking. Heart attack is one of the most worrisome part. It happens when somebody has a problem with the heart. It not only causes pain, but it also can make the heart stop. And if the heart stops, there is no circulation. And where there is no circulation, there is no perfusion to any vital organs, including the heart and the brain. That's where our skills of CPR will help, and it will save a life. Choking is another dreadful thing to watch, and therefore restaurant staffers in US are expected to know how to relieve obstruction before the person that they are serving has a respiratory arrest, and before they turn blue or they collapse. Universal precautions are important. You need to be careful so that you don't pass on infection or get infection for yourself. But remember, the life you save may be that of your own and one that is dear to you, and therefore sometimes you may not have enough time to have the universal precaution. Basically, today what we are going to emphasize is on learning CPR and basic BLS skills and practice them. It's important that you do it right because they're meant to save lives. As far as these webinars are concerned, we as organizers, presenters, moderators, panelists, and discussants have no conflict of interest except to learn from you and for you to learn from us and give an expanded knowledge for everybody so we all can share the knowledge as necessary. During this course, we will be outlining Day 1 and Day 2, where we'll emphasize on basic life support, its definition, a little bit of its history, systems of care, recognition of cardiac arrest and respiratory arrest. We will talk briefly about the overview of BLS and AED and early management of cardiac arrest, avoidance of cardiac arrest, how it should be done, resuscitation efforts for cardiac arrest victim. We'll talk about relieving choking, respiratory arrest management, overall care of the patient, and team efforts. And this will be done over the 2 days, not over 1 day. Remember, whenever the event occurs, it can happen anywhere. It can be out of the hospital, in a playground where the kids are playing. It can be at home. It can be out on the street, or it can be at a party where everybody is gathered together and having a good time. But always remember, you're there to help a person that is in need. Whenever you have a problem, always remember to call for help when you see someone that is in distress, as you never know how long will it be for the help to arrive. It may take a half an hour, it may take 5 minutes, it may take a minute. Therefore, before helping somebody, always ask for help. And you may need an AED in some cases, or you may need some additional support and transportation to help the person get up, or, start feeling better. In the hospital, the second part over here, prevention is the key. People are in the hospital in order to get better, not worse. The key is avoidance of life-threatening event. Do not let a person who cannot swallow properly be left alone with a food tray. There is nothing better than good smelling food when you are hungry. And at the same time, you may see somebody who is trying to get up, who wants to run to the bathroom, but he's orthostatic. You need to help them balance themselves to prevent a fall. And if you can prevent an event, that's the best thing to do. Of course, when an event happens, important part is always to call for help, whether it's a call button or a shout out in the hallway. There is only one goal: help the person be normal again, either by resuscitation or by prevention. People, education equipment like AED, gloves, face masks are important structures in the hospital, but outside, you may not have that. You just need to make sure that you're able to help people and the people are educated about what to do. We talk about protocols, policies, and procedures in the healthcare environment, but outside we need to know when and how to call for help. That is where 911 or 122 comes to our rescue. There are programs in the organization and cultural issues which we need to overcome over time. Think about it. A female giving CPR to a male or mouth-to-mouth resuscitation. Some of us don't like it, but life safe is important. We need to overcome these barriers to improve quality, safety, and patient outcome. Most institutions do have such a continuous quality improvement program, and because of it, as far as BLS and ACLS is concerned, it has become mandatory in the hospital. Irrespective of the point of entry, the BLS components remain the same. We need to know how to quickly start the chain of survival. We need to make sure we know how to deliver high-quality chest compression for adults, children, and infants. We need to know where our AED are located and know how to use them before an event really happens. You need to know how to provide rescue breathing when it's necessary and understand how to perform as a team if you're at an institution. Sometimes we take too much responsibility to ourselves without passing responsibility to the others. So it's important to learn to share responsibility so everybody has a job that's assigned. And of course, we all need to learn how to treat choking because choking is so common, especially when you go out to eat. For chain of survival, we first need to recognize the problem. We don't want to wake up a sleeping person, make sure that the person is sleeping and does not need help. If the person needs help, learn to call for help, either 911 in USA or 1122 in Pakistan. You can use a hospital code blue button or use a cardiac arrest call button, depending on the institution where you are. It is important to do high-quality CPR with emphasis on high-quality chest compression and full recoil. The full recoil part is the part that a lot of people tend to miss, and that's where they tend to fail the CPR training. As far as defibrillation goes, know your AED before an emergency happens. Know where it's located, how and when to use it, And it's very important to get advanced healthcare help as soon as possible because you need to get the victim to the hospital or ambulance. It's your responsibility till such time an advanced healthcare personnel takes over. So know your responsibility. You're responsible for the person till such time somebody else takes over. Post-resuscitation care is important. Sometimes the victim may wake up, may feel better, and after a few seconds, he may again pass out. So they need care and continuous observation. It's important that they get medical or surgical treatment as is needed. And they also go through rehabilitation, whether it's physical or emotional, depending on what you need. Why BLS? It's important to know that BLS helps save lives every day. Yet, did you know at least 70% of the people all over the world feel helpless to act if someone near them were to suffer a cardiac arrest? Why is that so? Because we don't have a presence of mind and we don't have the confidence we need in order to provide BLS or CPR to a person as it's needed. At our institution, we do quarterly training for healthcare providers. And in some institution, it's done yearly. In some institution, it's done every 2 years, depending on the circumstances, what kind of facilities that are available. It is important just to make sure we keep doing it because life-saving skills are needed. Immediate CPR on an unconscious person will help preserve cardiac and brain function. It'll keep the blood flowing and vital organs will stay alive. It will also keep us ready for emergencies as they may arise. BLS does not require a degree, but it requires a presence of mind. Even a young teenager or kid can give CPR, but basic life support requires education. And that's where we as healthcare providers are trained to do BLS, not just CPR. It is not difficult. You need to learn and you need to teach it to everyone you know because life does matter. We have only one life to live and live it to the fullest. We also need to learn how to give abdominal thrust to someone who is choking, chest compression to someone who is not, if we are not sure if the person is without a pulse. Even if your pulse is there and you give it to them, it will still save a life. In US, we also encourage people to consider naloxone in opioid overdose and not just knowing about the AED. So if you are doing BLS in the USA, you must know about when to use naloxone in patients with opioid overdose. This is a brief history about BLS. BLS importance, as you can see, did not start overnight, so don't expect to learn everything overnight yourself either. Take it in bits and pieces. Look at the BLS history as I showed here. It was well over 200 years in making before it was recognized as a need for physicians to learn it. And now we have CPR kits and 20 minutes to learn on breaks at meetings. Think about it, how things have changed over the years. CPR learning is important, and CPR learning kits are available at some airports for people to learn while they're waiting for their flights, because number of places, events did happen at the airport and they didn't know what to do about it. CPR kits help in learning to do compression, and that is why it's very important to learn and use it properly. We need to practice it. As I mentioned, it does not come overnight. Factors that are associated with improved survival in cardiac arrest include having trained individuals in CPR. People need to be confident and need to do it well. They must also be able to recognize cardiac arrest when it happens and provide high-quality CPR and provide rapid intervention for best healthcare outcomes. As a rescuer, a number of fears do come up. And a lot of people have asked this question, I'm not sure how my skills are. Will I harm the person more than I benefit? What if the person gets hurt or if he dies? What if I get sued? A patient accuses me of harming him or her. And the other question that I always get is, can I get infection from the one that I'm try save? Can I do only hands-on CPR? A lot of questions come up. We also worry about if the victim is not in a good neighborhood. It's not in a safe area, in a dirty area, slippery area, dangerous area. There's a fire going on. There's electricity or water. Remember, safety comes first. But as far as the other excuses, is the patient going to get hurt? Is the person going to sue me? Can I get an infection? Those are not important. You need to go with a positive attitude and learn to help others wherever you can. Get confident in whatever you want to do, and then you will do it. There's Good Samaritan Act. It says CPR can cause broken ribs and bruising, whether you have internal or external. It is well known. You're trying to do CPR, you can put in a lot of chest compression, and yes, you can cause problem. But good faith emergency care is protected from civil liabilities unless willfully negligent. Some examples that are given are unconscious or clearly needing help in a person, and the person is unable to consent. Go ahead and help them. Good Samaritan Act will protect you. If the victim is a child and a guardian is not there or unable to consent, go ahead and help them. They need help. Exclusion is, if anybody offers you a compensation or reward, never ever accepted in the case of BLS. If you do, then you're not protected. Just like you do blood donation, you do organ donation. When you do that, you don't accept a remuneration. Same thing about BLS. It is given with good faith only. What are we trying to do? We're trying to bring in a change. Now, getting back to the topic, we as a group, APCNA, Apna, Dr. Ambar Ashraf, Dr. Mahani Sahar, Dr. Horshman, Dr. Mate, Dr. Sadia Ashraf, all of us want to see change. We want to increase bystander CPR response rate in Pakistan. We want to improve CPR performance over time. We want to increase public awareness, and we also want to have public and medical professional education and training to continue. Will it happen? Of course it has happened. Last year after the session, we had more mass education for CPR. And of course, there was creation of master educators and trainers in some institutions. So we know we are making an impact and we need to continue doing the same. Number of jobs in US require CPR training, especially in US as part of their job security, not just for the healthcare provider. I know in the US hospital, your job can be terminated if your BLS has expired, and you can be terminated without warning. So BLS is extremely important. So please, those of you that are in the hospital working in US, make sure BLS does not expire. CPR training is also required for a number of jobs, for example, for childcare providers, for teachers in US. You need it for babysitters, for nannies, daycare supervisor, nursery care worker. Parents, they are taught how to do CPR before they give the baby to take home. Scoutmasters, they need it. You also need it for the flight attendant, athletic coach trainers, and as I mentioned, for the counselors and security guards, as well as those people that are working in the restaurant. Restaurant staff are required to know CPR because this is where a lot of choking does happen. CPR is a component of BLS. That question is asked quite often to me. What is the difference between the two? CPR involves chest compression and artificial ventilation to help someone who has no pulse and is not breathing. It can be done by a kid. BLS includes CPR with a slight more advanced option, a bit more medical training and equipment use. BLS is based on working in teams with other medical professionals, while CPR can be done by single rescuer or more than one person. BLS is a healthcare level CPR that requires more decision-making skills. In order to pass the BLS, there are 6 basic things that you need to know. Number 1, how to do high-quality CPR for adults, children, and infants. You need to know the chain of survival, especially the BLS components. You know the role and importance of early use of an AED, effective ventilation with or without a barrier device, role of team members in multi-rescue CPR and be an effective team member during multi-rescue CPR in a hospital setting, and also know how to relieve foreign body airway obstruction like choking in adults and infants. Without these, you do not pass the BLS. So make sure you know them cold and learn about them over time. CPR is the basic and first component, and safety comes first. Remember, whenever you see somebody who's feeling like he's sick, it may be not as bad as it seems. All that person needs is a little bit of sip of water, a little bit of assurance, and you'll be fine. Or the person may be unresponsive. If they're unresponsive, then you have to check if they're breathing or not breathing. If they're not breathing, EMS must be activated before you start the CPR. Always think positive. Always think that there's help available. Try your best to help. You never know how long it will take for the help to come, but if you ask for help, help will eventually come. So the steps to follow are, number 1, you make sure that the area is safe, then perform the basic BLS step. Number 1, If the person is unresponsive, call 911 or 1122 or ask someone else to do it for you. Lay the person on the back and open their airway, check for breathing and pulse. If there's no pulse, then start CPR. You don't spend more than 10 seconds looking for a pulse. More than 10 seconds is considered too long. Perform 30 chest compression and perform 2 rescue breathing. Continue doing it till an ambulance or automatic external defibrillator arrives or somebody else takes over. It is your responsibility to do the chest compression and rescue breathing. And if the second person is there to help you, have them do the chest compression while you do the rescue breathing, because rescue breathing requires a little bit more coordination than the chest compression. So the initial steps of BLS, number one, make sure the skin is safe. Look at the initial impression, see how the person is looking, and if the patient is conscious, check for responsiveness. You can do it by shaking the person, or you can calling out that person's name, whichever way you try to wake them up. And if they're responsive, well and good. If not, then you have to worry about them. You call for help. You can do it with your cell phone. You can do it with a call button or local emergency number. You can use 911. You can use 1122. But if the person is unconscious, and especially an older person, an adult, make sure you ask for an AED. Tell them you have a person who is down. Even in infant and children now, these days and age, we are asking for an AED to be brought in. Check for breath and pulse together. And as I mentioned, no more than 10 seconds. You check for it together. If you don't see the chest rise, you don't feel a carotid pulse, it's time for you to go ahead and start the CPR. In a child or an infant, you would be feeling the brachial or the radial, brachial or feeling the femoral pulse because the neck's a little bit on the short side. In the adult, you place the hand heel on the breastbone in the center of the chest wall and press hard, keeping your elbow straight. Chest compression should be 30 compression to 2 breaths, and the compression rate should be no less than 100 to 120 compression per minute. If you slow down, if you try to go for the breaths, the number of compression will fall down. So it's important that you keep up with the compression as fast as you can. Press to a depth of 2 to 2.5 inches, no more than 5 to 6 centimeters on the chest wall. Believe me, if you push hard on a person who is big, you're not going to go any deeper than 2.5 inches. So you're not really going to do more harm unless a person is a really small person. Press hard and fast, and always remember to allow full chest recoil with each compression. If the pulse is present, you have to do rescue breathing. Open the airway. Rescue breathing is 1 breath every 6 seconds or 10 breaths per minute. You need to check pulse every 2 minutes in an adult and put the person in a recovery position. Recovery position means that you tilt the head to one side, so if they have any secretion, it can come out and not choke them over time. You could also do a head-only CPR in a person who has no pulse. Again, you do 30 to 2 CPR, and you can use a high-performance team to help you out. Main components of CPRs are chest compression, airway, breathing, and defibrillation. Start with the chest compression, then look for the airway, breathing, and look for the defibrillator if an AED is available. It's very important that you leverage through technology. Your cell phone is the most important thing. You can dial 911 or 1122, depending on the place where you are. You can text information. You can even get an EKG this day and age and transmit an EKG out to the center which is receiving your call. You can text messages for help. For example, you don't know what to do next. You can ask them for help. They'll say, continue with CPR. They will expect you to keep the volume up. So you can keep calling the number and they'll call out the number with you so you know that you're doing the compression as needed. You have to use a speakerphone while doing CPR to be guided through or give information. In some places, we have the red phones in the emergency room, which are meant only for listening uninterrupted. And these are the ones that they get information from layperson or EMS of the incoming wounded. Even lock phones can be used. They can be bypassed with an emergency button. And as you know, most of the cell phones do have an emergency button. You can push on it, bypass it, and call 911 as necessary. Some of them also have apps and software to enable rescue. And if is available and it has been registered with the EMS, trained personnel will be available that are available locally will come and will help you with the AEDs. Landlines and voice-activated phone must have an accurate location. 9 out of 10 chances are some people may have put up their location off. If they did, it's very hard to find where you're calling from. Everybody's cell phone is coming from one region versus the other, not from the same area. Sometimes outbound calls from the landline may be difficult because the person that owns the phone may not be allowing outgoing calls, but only allowing incoming calls. So sometimes you may be limited if you have a landline and if you're trying to help somebody in their house. So be aware of that. But cell phone, are the main thing these day and age. So the critical requirement for high quality CPR are you should start chest compression within 10 seconds after recognizing cardiac arrest, push hard, push fast, compress at the rate of 100 to 120 beats per minute with a depth of at least 2 inches in an adult, but no more than 2.5 inches, at least 1/3 of the depth of chest or approximately 2 inches with children, and at least 1/3 of the depth of chest compression of 1 to 1.5 inch for an infant. You can use your thumb, or you can use the encircling method, or you can use your 2 fingers. We will discuss that in the next session. You must allow to complete chest recoil after each compression. And as I mentioned, this is where a lot of people fail in the CPR because they're not allowing chest recoil after each compression. It's very important to avoid leaning on the chest between a compression. Keep your elbow straight, and this chest will rise up immediately. Minimize distraction for CPR to less than 10 seconds. Learn how to give effective breaths. Deliver each breath over 1 second, enough to make the victim chest right. But avoid excessive ventilation, especially in young children, little people, because when the stomach is full, your chest compressions are not going to be effective. AED, as I mentioned, is the automated external defibrillator. It is used to help those experiencing sudden cardiac arrest. It's a sophisticated device, yet it's easy to use medical device. It can analyze the heart rhythm. If necessary, it will deliver an electric shock or defibrillation to help the heart reestablish an effective rhythm. As I mentioned, it's easy to use. It recognizes rhythm, gives shock, and it saves lives. And depending on the institution where you are, the shape may vary, and the AED may vary in different kind of formats. As I mentioned, AEDs are easy to use. Basic steps for AED are simple. Number one, continue CPR as the AED is being turned on. It may take a few seconds for it to beep and tell you that it's ready and it's on. So continue the CPR for those few seconds. Bare the victim's chest and wipe it dry. You can use your cloth, or you can use the person's shirt, whatever, just to dry it out. Attach the pad to the upper right and left side of the chest wall. Plug in the connector into the AED. This is the part a lot of people miss, they put the pads on, but they forget to connect the connector to the AED. You may stop CPR and let the AED analyze the victim's heart rhythm. It may advise shock. If it's advise shock, then you have to push the shock button. Unless you push the shock button, the shock doesn't go through. Or it may say no shock advice or needed. Irrespective of that, that means you have to continue with your CPR because you do not know if the person is a flat line or if the patient has a weak pulse that you cannot feel, and therefore CPR is the one that is required. Remember, AED does save life, and this has been done by bystander witness, shockable heart rhythm, and you can find that survival rate had increased compared to the one without getting a shock. CPR can be done by one person. Sometimes the help may take longer to come. Remember to check the pulse and curate it for less than 10 seconds. When you're not sure if you can feel a pulse, go ahead and just start your chest compression and 2 breaths. Place heel of one hand on the lower half of the breastbone on the chest with other hand on top of the first hand. Keep your arm straight, lock your elbow, and press straight down. It's not hard. If you start learning how to lock your elbows and pressing straight down, you don't need a lot of pressure. Must do 100 to 120 compression per minute in an adult. You must allow complete recoil between each compression and count each compression loud. More often than not, you might forget to count a number. Therefore, counting each compression loud is the most important part. 30 compression, then you do your held tilt chin lift, give 2 breaths, each of 1 second, allowing chest to rise with each breath, and then resume compression. Moving from one place to the other, you're going to lose a little bit of time, but it's worth it. You need to do your breath and you need to do your chest compression. For infant 0 to 1 year, if the person is unconscious, if the baby is unconscious, you look for the scene. Is it safe? If the scene is safe and if there's no adult around there, go ahead and lightly tap for response. Look for normal breathing. If there's no response, and if you're alone, do 2 minutes of CPR, then call EMS. You may text or call on cell phone if available. If alone and collapse is witnessed, first call EMS and then to bring the AD, then start the CPR. But if you see a person, a baby that is down, then do the CPR first before you call EMS. And I know there's a difference of opinion if we should do it one way or the other, but generally it's recommended if you're alone, first do the CPR, then call EMS. And if you witness it, then you have to go ahead and call EMS first, then start the CPR because you have a little bit of time there. When there are two providers, have one of them call EMS. You must tell the person by name saying, Mr. Jones, I need you to call EMS, bring me an AED, and you go ahead and start CPR. The louder you shout, the faster you shout, the more aggressive the person is going to be in calling EMS. If you're soft-spoken and say, please call EMS, please bring me an AED, nobody's going to help you. Please go ahead and call that person by name and ask them to do it. Place the baby or the infant, whoever you have, in a hard, flat surface. Look for circulation. Feel either the brachial or femoral pulse less than 10 seconds. If there's no pulse, start your CPR. If the pulse is present, that means only respiration is it, and you're in a better luck. Recheck the pulse every 2 minutes. If there's no pulse, do 5 cycles of CPR, which takes approximately 2 minutes. So you always start with chest compression, 100 to 120 compression per minute, 30 to 2. And you can do a 2-finger with 1 finger breath below the nipple line. You can put your 2 fingers and press onto the chest, or you could do the hand circling method, whichever way you like. Compression should be at least 1.5 inch or 1/3 the depth of the infant's chest wall. Remember to push hard and fast. We always worry that we might hurt the baby in the internal organ. That can be repaired, but when the baby dies, the baby is not going to come back. Always allow for full chest recoil and only allow minimal interruption to the chest compression. Sometimes we get distracted. Somebody's trying to give you this advice or that advice. You as a compressor must continue with your chest compression. Again, in child, you need to use one hand. In an infant, you use your 2 fingers or you do the encircling method. But in an adult, what you're requiring is 2 hands in order to press onto the chest fast. As far as chain of survival in the hospital is concerned, early recognition and prevention is most important. And as I mentioned, do not allow someone with swallowing difficulty without observation to eat. Recognize medical conditions that can lead to cardiac arrest and treat them before they become a major problem, like high blood pressure, changing the diet, medication, arrhythmias, etc. And always remember to activate emergency response system right away at first sight of impending arrest. Early CPR and a high-quality chest compression are a must. There's no exception to it. Defibrillation is important, and post-cardiac arrest care is important in people that may have had a cardiac arrest. And finally, rehabilitation is equally important. In our institution, we have core resuscitation skills that we need to pass. We must do adult and child compression, adult and child ventilation, infant compression, and infant ventilation every quarter. Some of us are lucky and don't have to do it once every 2 years, but at our institution, those that have been in the system have to do it every quarter. And believe me, it's worth it. Baseline and core skills are evaluated. When it's done, at first it gives you no feedback. And the second time it tells you how you did. And of course, this is mine. It tells me that I have been working hard at first, and suddenly I got distracted towards the end, and I'm not pressing as hard as I should. And it tells you the percentage of time that we have gone slow and we have gone faster. And, it's a good way of evaluating yourself. This is a kind of post-activity debriefing. It tells me what my score has been, how often have I missed in doing my chest compression as it should be. We have feedback immediately available, and same thing may happen to you when you go into your class. You may have a mannequin, you may have a voice-activated one, something that's recorded, or you may have somebody watching you. The feedback that you're given are usually on chest compression, what the depth is, and if you're allowing recoil. If you fail in one of the 3 of them for multiple times, of course, you will be asked to do it again. Of course, there's feedback for review. Chest compression fraction is what we're looking out for. We're looking at the ventilation rate and how much of air that you're pushing in through. If the chest didn't rise, your breath went to waste. You have to readjust the head and tilt and go ahead and give the breath again to the person. If you fail, as like we do, we have remedial tip videos that we have to go through. And once we go through the videos, we have to redo the things. So don't feel shy. Anybody can fail. And once you fail, you can go ahead and redo it again. There is no penalty for redoing it again. To summarize for today, verify that the scene is safe. Safety comes first. First, you need to establish unresponsiveness. If the person is unresponsive, you need to activate EMS. Once you activate the EMS, you look for the breath and pulse together and go ahead and start doing the CPR. Things to remember, safety comes first. Help when it is needed. If somebody looks like he's in trouble, go and help them. You will not be penalized for helping somebody who is in need. Get help. Shout, call on others to help you, use cell phone, whatever technology that's available to you, go ahead and use it. Universal precautions are important, especially in a hospital. Try to put on your gloves, or you can use a plastic bag to cover your hand while outside. And sometimes some people use bleach, a little bit of bleach with water in order to sanitize their hand. But make sure you don't overuse it. Learn where to find the call button if you're in a hospital. Look for where the AEDs are located. Most AEDs in the hospital in US are next to the elevators or next to the staircase. And that's where they are in majority of the floors. Some places they have AEDs already, defibrillators already onto the crash cart that are available on every floor. So it all depends on how sophisticated your institution is. You may have it on the wall, you may have it on the crash cart. And it's important, once a pulse recovers, go into rescue breathing and watch the victim till help arrives. I have seen more than one occasion when the victim has been left alone and has lost his pulse and his breathing. So it's important that we have somebody watching that person. In US, we connect them to the monitor beeps to you and it tells you that the person's alive and is beeping. And, if the patient stops breathing, it starts beeping in a different way. But sometimes, you may not have those technologies. So you have somebody sitting next to the person, talking to the person, feeling the pulse every few minutes to make sure that the person is alive. Get the victim to the nearest hospital. Getting them to the nearest hospital will help you understand what has been done for the patient and if the patient is making through. There are some additional points that you need to know. Number one, early initiation of CPR is very important. Risk of harm to the patient is low if the patient isn't in cardiac arrest. So whenever you think that the person is in cardiac arrest, go ahead and start your CPR. It is sometimes difficult to determine if there's a pulse for laypersons. So you may not be used to checking the pulse very often, and you may be just like a layperson. If you don't feel a pulse, it doesn't feel right, the person looks great, go ahead and start your CPR. Remember, the risk of withholding CPR from a pulseless victim exceeds the harm from doing the unneeded chest compression. So don't feel shy about starting the chest compression. Cardiac arrest survivors definitely need multimodality rehabilitation. Some of them may need to go to the cath lab. Somebody may need just to have some medication to support them. Some people may need some ventilation. We have all other different kinds of devices like ECMO, balloon pump, etc., that some people may need over time. The guideline recommendation in education is important. You need to know that nobody is forcing you to do training at one time. You can do frequent training in smaller bite-sized pieces. Like it's done at our institution. We do 2 things at a time, but 4 skills are done together. And then as far as the other things, for example, question answers, drugs, medication, and all that, we do it in pieces over time. You have to have booster session. People that have attended last year are attending again this year. They do realize getting a little bit of booster training does help them remember more about what has been done and what needs to be done. You need to have spaced learning approach, means that you do a little bit today, a little bit tomorrow. That's no problem. But as far as the exam is concerned, you're expected to do all the things, the viva, the hands-on training, the skills and doing your multiple choice questions, all of them will have to be done today. It is important to consider a combination of self-instruction and instructor-led teaching with hands-on training at any institution wherever you can get it done. Most hospitals do have it, not just in US, but in other countries. But if instructor-led training is not available, self-directed training is also recommended. So you can use that. And I thank you for your attention. Thank you, Dr. Ashraf. You can go ahead and take over.
Thank you, ma'am. It's always lovely and wonderful to listen from you. You have started the thing in a very nice way and cover all these concepts in very easy and simple way. And that's really fantastic. There are a few questions I would like to ask from the panelist. Dr. Sadia Ashraf, you are around? I want to ask a question from you, Dr. Sadia. As one of the participants asked, in infant, are we going to check the pulse? So just answer this and tell us what's the difference between child and infant CPR.
Assalamu alaikum. Thank you very much, Dr. Amba. And thank you, Dr. Morton, for a very nice presentation. The question is very good. As ma'am has explained, that definitely for the infant, we also need to have a pulse check, but it is not the carotid pulse that we are going to check while we are examining or assessing the infant. It is basically a brachial pulse, and brachial pulse which we checked is at the medial end of the forearm, and just press it as we do for about press and try to count it for 5 to 10 seconds, not less than 5 seconds and not more than 10 seconds. And you have to manage yourself and time yourself, because you don't have a clock, right? You may not be able to access a clock or anything. So there's a universal rule for timing yourself in order to know that you have to measure the pulse for at least 5 seconds. And the commonest way is to attach or to count it loudly, for instance 1 in 1000, to add a word along with the single number: 1 in 1000, 2 in 1000, 3 in 1000, 4 in 1000, 5 in 1000, 6 in 1000. If you just start practicing it, it means that it's almost a 1 second or less than 1 second, and you may count yourself like this. The other part of your question is, what's the difference between the child and an infant? I would like to highlight the differences between an adult and a child. As we know, for a single rescuer, we have to do a compression to ventilation rate. For the infant, for the adult or the child or infant, it remains the same, that is 30:2. 30 compressions and 2 breaths. But when there's a double rescue, 2 rescuers, then in the adult it remains the same, that is 30:2. But in child and infant it changes, it becomes 15:2. That is 15 compressions and 2 rescue breaths and 2 ventilations. And the same would be for infant as well as for the child. The second important difference is the pulse check. And as I already explained, that in infant, the pulse check is at the brachial artery. We need to palpate the brachial artery. And for infant, if you want to check the responsiveness, it is the most sensitive part is that of the sole of the foot. So you may tap over there and check the responsiveness over there.
Thank you, Dr. Sadia. you have explained this concept, and that's really very important for our young house officers, PGs, while they are performing it. Because that's very important in the infant. The most important underlying cause for these arrests are underlying respiratory problems. And that's why we reduce the compressions as compared to the breaths, increase the breaths whenever we have got two rescuers. Thank you, Jay. But I just want to ask one thing more regarding our house officers, students. What is there in the PMDC curriculum now? Is that mandatory or not? Because that is something we want to educate our juniors, especially those who are coming for the MBBS courses and for these PG courses. Thank you. Would you like to comment?
Yeah, sure. As far as PMDC revised curriculum is concerned, it is aligned with all the international standards, and as in the undergrad throughout the world, it is mandatory. So definitely it's part of a curriculum in the undergrad as well as for the house jobbers, that is the house officers. It is mandatory that during their house job they must have this BLS certification, and different hospitals they are now doing it on regular basis in order to equip them with the skills and the knowledge and skills in order to be a safe doctor and to be able to save the life, because it is something that is mandatory for a layman. And all this activity and efforts are in order to increase the awareness and to highlight its importance. And that's why in the PMDC curriculum, yeah, it is also mandatory. And for house job certification, it is also mandatory that they must have this updated certificate.
Dr. Sadia, the last question which I want to ask, because the participants are asking about AED. Whether we have this AEDs available nowadays in our big airports and the things like this, because that is something which is the need of the day, and we must have to aware our general population and everyone regarding it.
Okay, thank you very much. A quick answer is yes, it is available at the airports, at big malls, and it is a mandatory SOP in order to get a recognition, that is approval for the malls and shopping malls and different airports or the stations. But unfortunately, most of the time, we as a bystander or even the healthcare providers, we are not aware of how to use it. So they AED is automated external defibrillator. It is different what we have got at defibrillators at hospitals, because that's something we have to recognize whether it's a shockable rhythm or not. But automated external defibrillator, as ma'am has explained, that it is something that a sophisticated machine that by itself recognizes the rhythm and give a shock if advisable. And we know that there are two rhythms that needs to be that are shockable. One is ventricular fibrillation and the other is ventricular tachycardia without pulse, pulseless VT. So these two are shockable rhythms, and AED, when properly we apply it, it recognizes itself whether it's it is required to give a shock or not.
Thank you, Dr. Sadia. Our other worthy panelist is Professor Dr. Mati, and he is the Dean of Allied Health Sciences in Islamabad University. Sir, are you around? Professor Dr. Mati? I would like to ask a question that the audience is asking. Is Dr. Mati around?
No, we don't see him.
Okay, fine. It's perfectly okay. There is a question. What are the common mistakes that most of the time we observe during performing a BLS courses in our students? Anyone from other panelists would like to answer?
The problem.
Ma'am, would you like to take this, or can I add something to it?
Sure, you can add if you like. And generally, the one that I see is people are not allowing full recoil to happen. They just go into chest compression. Sometimes they forget to make sure if the patient is awake or not, if the patient is sleeping. Those are the two things that I find major issues in BLS.
Yes, ma'am, you are true. Once we have conducted a courses in Lady Reading Hospital, and next very early in the morning, there was hue and cry in the ward. One of the PG in the chest ward, while doing a round, he thought that lady is not responding, and without checking for the response, he have started the CPR on that lady. So that is very important. We must first do the scene safety. That is important for us. Most of the time, the people are not looking for that. Secondly, check for the response. And the third very pertinent thing, which ma'am you have highlighted, that is the effective chest compressions. Because what is important, we all should understand the cardiac cycle is 0.8 second. The 0.3 second is systole, and 0.85 second is a diastole. So after the chest compression, there should be enough chest recoil so that an appropriate diastole should be there. Complete blood should return, proper ventricular filling, so that in the next compression, the proper blood flow to the rest of the body organs, the vital organs, in order to prevent the further ischemia and improve our CPR. Ma'am, there is one another important question I would like you to answer. Is there something different in the pregnant women? How should we proceed?
Pregnant women, you have to do is similar to you do it in adult. And of course, you have to keep your hands a little bit higher up, not necessarily keep it more towards the abdomen. That's the important part. But they need the same attention as you do for a person who is an adult.
Yeah, that is very important. That while as a house officers, as a healthcare professionals, we should understand how to proceed, and we can just give them a left lateral position, a bit of it, so that we can step down the uterus and the fetus, so that we can save the mothers. Any other question? In the chat box, I haven't seen the rest of the question. Dr. Sahar and Dr. Shnud has done very nicely. Any comment?
Most of them are very interested to know if they will get the certificate or when is the next class. So I guess that should be addressed.
Okay. I just want to highlight one important thing, that every Monday, the whole of the month of the April, that is today 7th and 14th, 21st and 28th. On 14th of April, inshallah, 8 to 9, we have a part 2 of this BLS session. And then for 21st and 28th of April, 8 to 9, early in the morning on Monday, we are going to have ACLS sessions. And for certification, yeah, it's just a certificate from the Apna Merit on the email, the way you have registered yourself. That is just a certificate of the attendance. Those who are interested to have their skill practice, the best thing is to go and contact their institutes, because most of the institutes are now having these BLS sessions free of cost in order to well-versed office and PGs. So those who are interested, like in Khyber Teaching Hospital, we are conducting these courses regularly. The same it's other institute in Peshawar. The same things happening in Lahore, Pindi, everything. So it is very important. Those who want to learn it, that is the one way to enhance their skills. Ji. Any other questions, Sahar, which you want us to answer? Because I couldn't find any more because you people have answered that very nice. In Karachi, actually, there's 2-3 very important things now. We have proper AHA certified centers in Peshawar, in Islamabad, in Lahore, in Karachi. Second, the CPSP definitely is giving these services for their PGs, supervisors everywhere. In Karachi, the Dog University, they have their own AHA certified courses. CPSP Karachi is doing it in whole of the Pakistan. Yeah, those who want to have a proper AHA certificate, for that they have to submit their whatever the charges and things are. No doubt, they are saying in CPSP it is on a proper fee for it, but they are properly being certified from the AHA. And in this fee, the AHA is providing them a proper, their online, what is all the materials, and then pre-test, post-test, full training for ACLS, 2 days training, and then post-test, written post-test, as well as a clinical code run testing for that. And after that, they get certified, and these certificates are valid for 2 years. And after 2 years, everyone should have to recertify this. Yes, in Islamabad, Pindi, Shafa Hospital and AFIC are not are doing the AHA certified courses. In Lahore, the same thing, the private institute being recognized, because CPSP is now looking after as a training sector coordinator and looking after all these centers in Pakistan. Anything else?
Dr. Ashraf, I think I should clarify one subject here. So I see some questions about the pacemaker and using the AED on it. So just as a reminder, pacemaker doesn't shock. So we can use the defibrillator or shock if the patient does have a pacemaker, so we can use it. So I saw this question just frequently. I just thought maybe I should give this answer live.
Thank you, Dr. Sayed. Definitely, those who want to know, the pacemaker is basically where there is a reduced heart rhythm, the heart blocks. There we are implant the pacemakers, and these pacemakers are not giving the shock to the patient, but there are advanced devices that as a cardiologist we are placing them, and that is for looking after the VTs and things like this, and that is something very advanced for the cardiology. So thank you very much. You have highlighted this issue.
Sure, thank you.
I think so. It is now 9 o'clock, and the session is for good 1 hour. Any question, any query? We have another 1 or 2 minutes. If not, then we would like to thank Professor Dr. Mariam Morton. I always get impressed the way she explained the things. It's always a wonderful learning. I'm grateful and thankful to our panelists, Dr. Seher, Dr. Husnud, Dr. Sadia. I don't know what happened with Dr. Matti. Most probably the next session he'll be with us. And thank you for the organizers and Dr. Waleed and everyone who have coordinated this IT program in a very nice way. Thank you very much.
Thank you so much. Certificate of attendance will be given only if the person has attended 85% of the lectures. If they don't, then they don't get it. That's important to know. And it's only a certificate of attendance, not a certificate of completion.
Thank you, ma'am, for clarifying. Thank you. Inshallah, next session will be on 14th of April, 8 a.m. early in the morning.